If you've had gout or you've been told your uric acid levels are high, you're probably wondering what you can do to bring those levels down and prevent painful attacks. The good news is that there are several effective ways to reduce uric acid levels, and many of them involve simple, practical changes. In this video, I'm going to explain what uric acid is, why it builds up, and most importantly, what you can do to lower it naturally and reduce your risk of gout attacks. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. Uric acid is a waste product that is produced when your body breaks down substances called purines. Purines are found naturally in your body, but they are also present in certain foods. Normally, uric acid is filtered by the kidneys and passed out of the body in urine. However, if your body produces too much uric acid or your kidneys don't remove enough of it, levels can build up in the blood. When this happens, uric acid can form crystals that deposit in the joints, leading to gout. So the key question is, how do we reduce uric acid levels? Let's go through the most important steps. The first is hydration. This is one of the simplest and most effective ways to lower uric acid. Drinking enough water helps your kidneys flush uric acid out of your system. If you're dehydrated, uric acid becomes more concentrated in the blood, increasing the risk of crystal formation. Aim to drink water regularly throughout the day. This is particularly important during hot weather, after exercise, or if you've been unwell. The second step is diet. As we discussed in the previous video, certain foods can increase uric acid levels. Reducing intake of high purine foods such as red meat, organ meats, and certain seafood can help. Alcohol is another key factor. Beer and spirits in particular are strongly linked to higher uric acid levels and gout attacks. Cutting down on alcohol can make a significant difference. Sugary drinks are also important. Drinks containing fructose can increase uric acid production. Reducing fizzy drinks and fruit juices can help lower your levels. The third factor is weight and metabolic health. Carrying excess weight is associated with higher uric acid levels. This is partly because the body produces more uric acid and partly because the kidneys are less efficient at removing it. Gradual, sustained weight loss can help reduce uric acid levels and improve overall health. However, it's important to avoid crash dieting or rapid weight loss, as this can temporarily increase uric acid levels and trigger gout attacks. The fourth factor is physical activity. Regular exercise can help improve metabolic health and support weight management. It also helps reduce inflammation in the body. You don't need to do anything extreme. Consistent, moderate activity is often enough. The fifth factor is reviewing medications and underlying health conditions. Certain medications, such as diuretics, can increase uric acid levels. Conditions such as high blood pressure, diabetes, and kidney disease can also affect how uric acid is handled in the body. If you have gout or high uric acid, it's worth reviewing these factors with your doctor. Now, an important question is, can you lower uric acid naturally without medication? For some people, particularly those with mild elevations, lifestyle changes can make a meaningful difference. However, for many patients, especially those with recurrent gout attacks, medication is often needed to bring uric acid levels down to a safe range. Medications such as allopurinol or febuxostat reduce the production of uric acid and are very effective at preventing gout attacks. The key is to use these treatments appropriately and alongside lifestyle changes. Now, let's talk about targets. In patients with gout, we aim to reduce uric acid levels to below a certain threshold, typically around 300 to 360 micromoles per litre, depending on the individual. This is important because it allows existing crystals to dissolve over time and prevents new ones from forming. Lowering uric acid is not just about preventing attacks, it's about treating the underlying cause. Another important point is consistency. Lowering uric acid is not something that happens overnight. It requires ongoing attention to diet, hydration, and overall health. Small, consistent changes tend to be more effective than short-term efforts. Now, what about supplements or natural remedies? Some patients ask about things like vitamin C or cherry extracts. There is some evidence that these may have a modest effect on uric acid levels, but they are not a substitute for proper treatment. They can be part of an overall approach, but should not replace medical advice. Let's now bring this together into practical steps you can take. Stay well hydrated, reduce intake of high purine foods, limit alcohol, particularly beer and spirits, cut down on sugary drinks, aim for gradual weight loss if needed, stay active. Review medications and health conditions with your doctor. And if you have recurrent gout attacks, discuss whether long-term treatment is appropriate. Now, when should you seek medical advice? If you have had gout attacks, particularly more than once, it's important to look at long-term management. If your uric acid levels are persistently high, that increases the risk of future attacks. If gout is left untreated, it can lead to joint damage and other complications. So while lifestyle changes are important, they should be part of a structured plan. To summarize, uric acid builds up when the body produces too much or does not remove enough. Lowering uric acid involves a combination of hydration, diet, weight management, and overall health. For many patients, medication is also needed to achieve and maintain safe levels. The key message is that gout is very manageable. With the right approach, it is possible to prevent attacks and protect your joints. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.